Okay. Um, if you were to look at the internal workings of the heart, you would see a complete wall called the interatrial septum, which separates the two atria from each other. The wall is complete because a hole has closed that existed in the fetal heart, called the fossa ovals. Another wall, the interventricular septum, separates the two ventricles. These two myocardial walls effectively divide the heart into right and left sides. Each side of the heart serves as a separate pump for blood. The right side of the heart pumps blood to the lungs, short distance, while the left side of the heart pumps blood to the rest of the body, long distance. Because the left side's workload is greater than the right side's, the left ventricle has a thicker myocardium. You can also see the presence of valves. The atria are separated from the ventricles by the atrioventricular valves. The tricuspid valve lies between the right atrium and the right ventricle. Notice that there are tendinous. Let me go down. Okay. Cords attaching the cuffs of the AV valves to mouths of papillary muscle in the ventricles. These cords resemble parachute cords anchoring the valve. Parachute to the muscle. You will learn how these structures work together to direct blood flow when the cardiac cycle is discussed later in the chapter. Semilunar valves, the pulmonary valve and the aortic valve, are located between each ventricle and the vessel that carries the pump blood away from the heart. The pulmonary valve lies between the right ventricle and the pulmonary trunk. The aortic valve lies between the left ventricle and the aorta. Rheumatic heart disease is an inflammatory condition of the heart associated with rheumatic fever, which causes inflammation in various body systems. Rheumatic fever is caused by a group A streptococcal bacterial infection, usually in cases of untreated inflammation of the pharynx, pharyngitis, or strep throat. Rheumatic fever can affect the joint, skin, central nervous system, and heart. In the heart, rheumatic fever can cause carditis, inflammation of the heart, which affects all of the heart layers, including the valves. Damage caused by this disease can be long-lasting and affect an individual years later, resulting in a chronic rheumatic heart disease. In this case, the heart's valves have undergone stenosis, a narrowing or constricting of the valves from the presence of the group. A streptococcal infection, excuse me, arrhythmias, and ventricular dysfunction can also result from chronic rheumatic heart disease, depending on how severe the heart damage is. Heart failure may also occur if rheumatic fever is diagnosed by physical examination and by testing for group A streptococcal infection. Electrocardiograms are done to assess the damage to the heart. Treatments for recurring carditis associated with rheumatic fever may include non-steroid anti-inflammatory drugs. So far, you become familiar with the anatomy of the heart. Now it's time to revisit cardiac muscle tissue to expand on what you learned about in histology.